gentlemen, it's really a great pleasure and honor indeed for me to be here on the platform of CSI TV on the occasion of 73rd Annual Conference of CSI. I am Dr. K Chopra, past President of National CSI from Delhi, India. The topic I presented today was early onset versus late onset of hypertension. What are the implications? I must tell you today, this is a very, very important topic to understand the clinical, diagnostic, and therapeutic implications of early onset and late onset of hypertension. We all know that the prevalence of uncontrolled hypertension is rising steeply in our country. If you see, the overall prevalence is almost up to the tune of 35%. Whatever studies are from India, like hypertension great study, which was published just last year from India, as well as the data from the world, reveal that uncontrolled hypertension is almost up to a very, very large extent a real problem responsible for hypertension-inflicted morbidity and mortality. When I say early onset, the cutoff age is less than 55. Anybody less than 55 is early onset. After 55 is late onset. Early onset is responsible for higher incidence of cardiovascular disease, morbidity, mortality, more target organ damage, and more event rate. So that's a matter of great concern. Early screening is required. And the early screening is by either a home BP monitoring or even in some situations, ambulatory BP monitoring. So I think it's very important if you understand the difference between the young and the old hypertension by pathophysiology. Early onset hypertension have more cardiac output, they have more sympathetic nervous activity, and they have more what we call as norepinephrine levels and high renin levels, and they also have less peripheral vascular resistance, and they have increase in blood pressure, both systolic and diastolic equally, as compared to late onset hypertension, where there's only systolic hypertension. Late onset hypertension is usually associated with a lot of comorbidities. The treatment of choice is very important. We all know the first drug of choice is inhibitors or ARBs and CCBs, and special situation we can use drugs like diuretics. Beta blocker also we use commonly in young hypertensives because the sympathetic activity is more. While in elderly hypertension, we have to be super selective, and where there is a compelling indication of beta blockers we should use, because most of these patients are having a comorbidities in the form of heart failure or stroke or CKD or metabolic syndrome and so on. So the implications are very clear. Diagnostics, home BP monitoring, ambulatory BP monitoring, ECG, biochemical parameters, and some of our patients we subject them to the echo guided treatment, and HBPM and ABPM guided treatment is a real approach to our patients to manage them meticulously. And all these drugs which I mentioned to you can be used in elderly hypertension and young hypertension. But there are some situations we have to use in elderly hypertension SGLT2 inhibitors. There is a huge role of SGLT2 inhibitors, ARNI we also use in a lot of patients, and even RDN or MRA are also used in a lot of patients who have comorbidities or if they have a resistant hypertension. A lot of work has been done recently on SGLT2 inhibitors, even in the hypertension with normal heart failure ejection fraction or with a heart failure with a reduced ejection fraction. So to conclude, ladies and gentlemen, my message is very clear that the morbidity and mortality is higher with early onset, target organ damage is higher with the early onset, and the CV events and cardiovascular disease and all-cause mortality is higher with the early onset hypertension. So we all should be more concerned with the early onset hypertension. And there is a new data which has emerged, which has shown that the premature decline of cognition function is also affected in early hypertension, which is uncontrolled. So objective is to control the hypertension so that it does not become a global tsunami. Thank you very much for giving me this opportunity and honor to be here on the CSI TV 2021 in the annual conference of CSI.